We've talked a lot about probiotics and support group, and I've given the results of some of the latest studies, but really I think we need to drop back and even describe what the probiotics are even doing. And that gives us the topic of what's called the gut microflora or microbiota. And what that means is this: inside of us, inside of our mouth and our esophagus and our stomach and our intestines, all the way down, there are bacteria and even fungus, if you can wrap your head around that, and they belong there. In fact, they're such a dominant part of our being that there's more genetic material in the bacteria and the fungus than there is even in our own native host cells. So it's a very, very powerful part of who we are. And so again, it's called gut microflora. And the types of organisms in the microflora matter. In fact, the more we study the gut microflora, the more we see that changes in the gut microflora are associated with diseases such as obesity, and also part of the power of bariatric surgery causes changes in the gut microflora. So when we talk about probiotics, what we're really saying is we want to put inside of us the bacteria that we need, and in some cases the fungus that we need to help us function better. So that's what probiotics do. There's also something called prebiotics, which is kind of like this. It's like, okay, you have this gut flora, these bacteria inside of us, but they've got to eat too. And what they eat is what we eat. So things in our food matter to the gut flora, and the kinds of things that we eat help the good bacteria inside of us. So that's called prebiotics. So again, we've got the gut microflora, also called the microbiota, and then we've got the probiotics, which are adding more of the organisms themselves, and then the prebiotics, which are the kind of foods that we eat, that we get nutrition from too, but also are important for our gut flora so that they can eat as well. And it turns out that they give us back a lot of things, which we'll go into in subsequent videos. I'm Dr. Robert Woodbury with Healthy Steps.